When my sleep was broken, it took me years to figure out what the actual problem was. I felt like I had tried everything and nothing worked. And it wasn't until I started training in sleep science and holistic sleep solutions that I understood why. Sleep is multifactorial. In my case, there wasn't one cause, there were several. And until I looked at all of them together, I couldn't fix my sleep. So in this video, here's what we're going to cover. We're going to cover what insomnia actually is and when to talk to a healthcare professional about your sleep. A simple framework that explains why your sleep got stuck even after you tried the obvious fixes. We'll talk about over 7 factors affecting your sleep beyond just hormones. Some you've probably never heard linked to sleep before. And lastly, I will share a self-inventory you can start tonight for figuring out what's really going on for you, because self-awareness is the beginning of transformation. This is the first video in sleep and perimenopause and menopause series. Today is a landscape, the big picture, laying the foundation for upcoming series. Let's get into it. When I started my nursing career in 2016, working as a nurse, I worked night shifts and my sleep fell apart. 4 hours of broken sleep, I forgot things, I stood in supply rooms, unable to remember why I went there. That experience pushed me into this work of studying sleep science and looking at natural sleep solutions. I have been trained looking at the relationship between sleep and hormones, sleep and thyroid health, sleep and gut health, sleep and nutrition, sleep and exercise, and other lifestyle factors. Looking at sleep as a holistic picture instead of just one isolated element. And so that's how I got pushed into this work, because I was trying to find my own solution. And this video reminds you that there is hope. And what I learned changed how I see sleep, and it changed my health forever. Sleep can break at any time, because as we evolve across lifespan, so is our sleep. So many factors affect sleep. Menopause does not always create the sleep problem from scratch. Often for many women, perimenopause and menopause exacerbates factors that were already there. And now with perimenopause and menopause, you see those factors more. So if you have been blaming yourself or blaming only your hormones, please remember that sleep needs to be looked at holistically. There are usually several factors at play. And once we can see those factors, you can bring them to your healthcare professional and start working through them. Let's look at what insomnia is before we go further. Just clarify what really is, because the word insomnia gets used so loosely. The International Classification of Sleep Disorders, which is the diagnostic reference sleep medicine uses, defines chronic insomnia in adults as a combination of things happening together. One, you have one or more of these problems. So number one, for insomnia to happen, you have one or more of these problems with your sleep. A, difficulty falling asleep. B, difficulty staying asleep, or waking up earlier than you want to. Number two, the nighttime difficulty is connected to one or more daytime symptoms, such as fatigue or feeling unwell, impaired attention or concentration or memory or mood disturbances, reduced motivation or energy daytime sleepiness. Number three, the sleep difficulty can be explained simply by not giving yourself enough time opportunity to sleep. Number four, the symptoms occur at least 3 times per week. Number five, symptoms have been going on for at least 3 months. And number six, the difficulty sleeping isn't better explained by another sleep disorder. So A few rough nights here and there is not chronic insomnia. That could be transitional. But if this pattern sounds familiar, what you're experiencing has a name and has been studied, and there is a real reason behind it, and it's really a great idea if you are relating to these descriptions of insomnia to discuss this with your healthcare professional, because again there are so many factors, and you can work with your healthcare professional to identify the factor and fix it. Let's continue to look into the other factors. So now let me share something that completely changed how I understand sleep and how I have helped myself and help other women with understanding their own sleep. It just makes perfect sense when you look at your sleep this way. So researchers have known for a long time that insomnia usually doesn't have one single cause. There is actually a framework that sleep doctors use to make a sense of what's going on with insomnia. It looks at 3 different kinds of factors that come together: predispositioning, precipitating, and perpetuating factors. It's been studied since the 1980s and confirmed in more recent research, including a 2021 study in the Journal of Sleep. When understanding the factors affecting your sleep gives you clarity and lowers the pressure as you look for solutions. Predispositioning factors are traits you carry with you that make you more vulnerable to sleep problems, such as genetics, a naturally reactive nervous system, a tendency to worry. These are often outside our control. Precipitating factors are events that trigger the sleep problem. For example, a stressful life change, an illness, a hormonal shift like perimenopause and menopause. Precipitating factors push us over what researchers call the insomnia threshold. Perpetuating factors are what keep insomnia going even after the original triggers have been resolved. Let's say someone who's in perimenopause and menopause and they've had their symptoms addressed and then the sleep problems continue. That would mean that there were some perpetuating factors, which leads to what I was talking about earlier, that might not be the only cause of sleep disturbances. There could be other factors that are also worth looking at and addressing. So sometimes it's asking if your hormones are balanced, even if the hot flashes stopped or the perimenopause and menopause symptoms are addressed. Are there any other patterns in your daily life that keep your sleep disrupted? This is why so many women try a few solutions and feel discouraged when their sleep does not improve. You might be addressing only one piece of the puzzle. So it's definitely worth looking at your sleep holistically. Now let's take a look at other factors. We are getting into the deeper factors that are worth discussing with your healthcare professionals. So when sleep is broken, right, the question becomes which factors are at play for you specifically. Here is a wide range of factors that research has linked to sleep problems. This is for your awareness so that you can bring these factors to your healthcare professionals if they apply to you. Let's look at the factor number 1, schedule and substances. Your work time, bedtime, regularity, caffeine timing. So caffeine is one of those things that everyone is going to respond differently, but it can take up to 10 hours for the caffeine to actually leave your system. So an afternoon coffee or caffeine drink can actually stay in your system until bedtime. So that can definitely disrupt sleep. So it will be a good idea to observe how caffeine affects you. It's going to be different for everyone. Alcohol fragments sleep, especially the REM sleep, which happens longer in the second half of the night. Nicotine, certain over-the-counter medications, and some prescriptions medications can also disrupt sleep. Second factor is your environment. Bedroom temperature, light exposure, noise, air quality, your mattress and pillow. The cooler your room, the easier deep sleep becomes. Number 3, breathing and oxygen. This is one most women never hear about. Sleep apnea is dramatically underdiagnosed in women, especially after menopause. So breathing is important because when we sleep, we are still breathing and all the bodily systems are still at work, but they are working at a slower pace to allow rejuvenation to happen. And breathing is really important for supplying oxygen to the heart and to the brain during the night. And there is a condition called sleep apnea, which is underdiagnosed. Sleep apnea is a breathing disorder during sleep where a person stops breathing up to 100 times during sleep, and this stopping of breathing, they're very short, but they happen frequently where a person is gasping for air and they might not notice unless someone is beside them and notices them gasping for air, and there won't be any other way of knowing except the next day. They may be having daytime sleepiness, they may be having daytime fatigue, they may be having morning headaches, and overall they may not feel well rested. This is so important because sleep apnea is dramatically underdiagnosed in women, especially after menopause. Women often present without the loud snoring that people associate with sleep apnea. So it's important to notice other signs associated with sleep apnea and discuss them with your healthcare professional, including dry mouth, waking up gasping for air, daytime sleepiness, or resistant high blood pressure, because when there is that reduced oxygenation to the heart and brain during the night, that can actually lead to high blood pressure and increased risk of stroke. Next factor affecting sleep is emotions and stress physiology, anxiety, hyperarousal, racing thoughts, trauma, caregiver load. Decades of accumulated stress often surface and affecting our sleep, and it's even more concentrated in midlife, right? We take care of everyone. You might be an aunt to somebody, a mother, so many different roles. I see the stress can accumulate. So that will be affecting our sleep, and there are so many great stress management strategies that we'll be talking about in the upcoming videos in this series. Factor 4 affecting your sleep is hormones. We've been discussing this in previous videos. Estrogen, progesterone, and cortisol patterns shift, especially in perimenopause and menopause. Thyroid dysfunction is common in midlife women, and the symptoms overlap heavily with perimenopause and menopause symptoms. Fatigue, weight changes, mood shifts, poor sleep. Many women are told it's just menopause when their thyroid panel hasn't been properly checked. Please ask your provider about your thyroid health. If you haven't checked your blood work in a long time, it might be worthwhile just to look at what your thyroid is looking like. Factor number 5 affecting our sleep is nutrition and the gut. What we eat, when we eat it, and the nutrients the body has access to: magnesium, vitamin D, B12, iron, vitamin C. There's a longer list of nutrients that affect sleep. Gut health has also been linked to sleep through inflammation and the gut-brain communication pathway. We will explore this further in future videos. So number 6, health conditions. So various health conditions such as chronic pain, acid reflux, iron and ferritin levels, different health conditions can affect sleep. The next factor affecting sleep is prescriptions and medications, and specific medications and prescriptions can disrupt sleep, and sometimes it is the timing of the medication that is the issue, not the medication itself. So it's always worth a conversation with your provider. If you just started on a new medication and you're noticing that your sleep is changing, it's always good to have that conversation. Number 7, other sleep disorders beyond insomnia and sleep apnea. People may have restless leg syndrome, circadian rhythm disorders, parasomnia, REM sleep disorders, and others. So this is why discussing sleep with your doctor is really important, because they can also maybe refer you to sleep medicine if they feel that you may have a sleep disorder, and they can further investigate that. Now, look at how many factors that is. This is why one fix is rarely going to be enough for your sleep. This is why I want you to look at sleep holistically and bring these conversations to your healthcare professional. Sleep is not one isolated element. Sleep is holistic. When sleep is broken, it's only a sign and a symptom of something bigger going on. So let's look at the practical strategies. Where do you start? Before any strategy is implemented, you need to know what you're working with. How is your sleep? Usually, I recommend having a sleep journal, and we can talk about that in the next videos. There's so many solutions out there, but it all starts by self-awareness. Self-awareness is the beginning of transformation. So here is a self-inventory you can do this week. Start by assessing how your sleep is subjectively. So number one, ask yourself the QQRT question. So the QQRT framework stands for quality. Do I feel restored when I wake up? Quantity. Are you getting enough total sleep for your body? 7 to 9 hours for adults. Regularity. Do you go to bed and wake up around the same time most days? Timing. Is your sleep aligned with darkness, or are you fighting your body clock, such as doing shift work or sleeping during the day instead of sleeping during the night? If all of these are off, that tells you where to start. Strategy number 2, when was the last time you had blood work done? If it has been like 2 years or more than a year, this will be a good time to ask your provider to just do baseline blood work to see how everything is. Just checking, right? Because there's so many factors. How you feel, how your body is doing affects your sleep, not just your bedtime routine. So that would be a good time to just discuss with them. It is recommended, even we don't have to be sick to actually get our blood work done. We can just check our blood work just for our own awareness, so we know which areas to work on. I acknowledge it can be scary, but if you make it a habit to check our blood work every year or every whatever recommended by a healthcare professional, then we don't even have to overthink it. We just go and get it done. Strategy number 3, how have you been feeling overall? Not just at night, during the day, your energy, your mood, your digestion, your stress level. Sleep does not exist in isolation from these. And in the previous video, I recommended creating a symptom journal. It can really be helpful to keep track of how you've been feeling for your own data collection and better solution. Because the more you have better information, better data equals to better solutions. Strategy number 4, what has changed? A new medication, a life shift, a change in routine. Notice what is different. This self-inventory is not a diagnosis. It is a way to see your own picture. So when you talk to your healthcare professional, you know what to bring up. It's a self-reflection. And it makes those appointments much smoother when we have already reflected before going in. So here's what I want you to take away from this video. Your sleep struggles have real causes. There are usually several causes, predispositioning factors that make you vulnerable, precipitating factors like perimenopause and menopause that push you over the insomnia threshold, and the perpetuating factors that keep you stuck even after the trigger resolves. Looking at your sleep holistically is the way forward. If this video helped you, share it with another woman who has been told it's just perimenopause, it's just menopause, and who deserves to know there is more to the story of their sleep. So next week, we're going deeper into one of the most common complaints women share: waking up at 3 a.m. and not being able to get back to sleep. As we already explored, there's so many factors. So we're going to be exploring holistic and effective solutions. Please turn on your notification bell and subscribe so you won't miss it. I also want to hear from you. Comment below and let me know what sleep struggle you want me to cover next. I read every comment. Research links are in the description below. I'm Joselyne. Take care of yourself, and I'm going to see you in the next video.